Chemotherapy is one of the most commonly prescribed treatments for mesothelioma. And if your doctor has indicated that it's the right choice for you, you might assume there's just one standard chemotherapy regimen. But that's not true. There are different chemotherapy combinations, different schedules, different purposes for giving chemotherapy, and there are ongoing shifts in what's actually considered best practice. Today, I want to explain the different types of chemotherapy used for mesothelioma, how they differ, and why your specific regimen matters. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding the available chemotherapy options will help you be a more active participant in your treatment decisions. So let's start with the standard first-line chemotherapy for mesothelioma. For decades, the gold standard has been pemetrexed combined with either cisplatin or carboplatin. This combination was established following a major trial conducted back in the early 2000s that showed that pemetrexed plus cisplatin significantly improved survival compared to cisplatin alone. Pemetrexed is a drug that interferes with folate metabolism, which cancer cells need for DNA synthesis. Cisplatin and carboplatin are both platinum-based drugs that directly damage DNA. So together, they attack cancer through complementary mechanisms. The combination is given intravenously every 3 weeks, typically for 4 to 6 cycles. Each cycle involves a full day in the infusion center receiving both drugs over several hours. But here's where variation comes in. Cisplatin and carboplatin are both platinum drugs, but they're not interchangeable. Cisplatin is slightly more effective, but it also has more severe side effects, specifically kidney damage, hearing loss, and severe nausea. Carboplatin is somewhat less effective, but it's much better tolerated with fewer side effects. Your oncologist will choose between the two drugs based on certain factors. Younger, healthier patients with good kidney function might receive cisplatin for maximum effectiveness, while older patients or those who have previously diagnosed kidney problems will probably receive carboplatin so that they can tolerate it more easily. Now, before I go on, I'm going to take a quick break and ask you to do me a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find it. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. So let's discuss some of the other chemotherapy treatments that are being used. Recently, newer first-line options have emerged. The IND 227 trial led to FDA approval in 2024 of pembrolizumab plus pemetrexed plus platinum chemotherapy. This adds the immunotherapy drug pembrolizumab, I can't pronounce things like this, to standard chemotherapy. The trial showed a 62% response rate, and that means that mesothelioma tumors shrunk in 62% of the patients. And this is a real evolution in first-line treatment. Instead of chemotherapy alone, we now have chemotherapy combined with immunotherapy as an option. Another first-line option is dual immunotherapy with nivolumab and ipilimumab without chemotherapy. Based on the Checkmate 743 trial, this combination showed better outcomes than chemotherapy alone, particularly for non-epithelioid cell types. So right away, we see that first-line chemotherapy isn't just one thing. It could be pemetrexed plus cisplatin, pemetrexed plus carboplatin, pemetrexed plus platinum plus pembrolizumab, and even immunotherapy without chemotherapy. Second-line chemotherapy comes into play if the disease progresses after first-line treatment. There is no single established second-line regimen for mesothelioma. Options might include gemcitabine, which is often combined with cisplatin or carboplatin, or vinorelbine. These drugs work through mechanisms that are different from pemetrexed. The theory is that if cancer became resistant to the pemetrexed, switching to a drug with a different mechanism could still work. Even so, going back to the pemetrexed platinum combination might be considered if there was a good initial response and a long interval before progression. Clinical trials of experimental drugs or combinations are often good second-line options. Maintenance chemotherapy is still another concept. After completing initial chemotherapy cycles, some patients receive ongoing treatment to maintain the response. This could mean continuing pemetrexed, continuing immunotherapy if that was part of the initial treatment, or switching to an entirely different drug or targeted therapy. The evidence for maintenance therapy in mesothelioma, it's mixed. Practices vary between centers. Neoadjuvant chemotherapy is given before surgery to shrink tumors and make them more removable. And adjuvant chemotherapy is given after surgery to kill any cancer cells that might remain. The drugs used are often the same as for first-line treatment, but the purpose and the timing differ. HIPEC, which is heated intraperitoneal chemotherapy, is chemotherapy given directly into the abdomen during surgery for peritoneal mesothelioma. The chemotherapy drugs used for HIPEC are often cisplatin or mitomycin C. They're heated to about 108 degrees Fahrenheit and then circulated through the abdomen for 90 to 120 minutes. This is completely different from systemic chemotherapy given intravenously. HIPEC delivers extremely high concentrations of chemotherapy directly to the peritoneal surface where cancer cells are located. It would be impossible to give the same concentration systemically through an IV because it would create such significant side effects and damage to healthy cells. But HIPEC takes advantage of the fact that the chemotherapy solution can be applied directly to the cancer cells without impacting the rest of the body. Now, speaking of side effects, are they the same for all chemotherapy? No. Different drugs have different side effect profiles. Pemetrexed commonly causes fatigue, nausea, low blood counts, and rashes. These are usually manageable with supportive medications. Cisplatin causes severe nausea, kidney damage, hearing loss, nerve damage in hands and feet, and low blood counts, while carboplatin causes low blood counts, especially low platelets, but less nausea, less kidney damage, and less nerve damage than cisplatin. Gemcitabine causes low blood counts and flu-like symptoms, where vinorelbine causes low blood counts and nerve damage. Every drug requires a different type of supportive care and monitoring. Now, why does the specific chemotherapy regimen matter? Effectiveness varies. Some combinations work better for certain cell types or stages. Tolerability differs. What one patient tolerates well, it might be unbearable for another. Dosing flexibility allows adjustments based on how you're responding and tolerating the treatment. One more thing about chemotherapy drugs. Eligibility for clinical trials often depends on whether you've already received certain chemotherapy drugs. It's important to remember. Now, how is your specific regimen chosen? Your oncologist will take many things into consideration, including your cell type. Epithelioid might favor chemotherapy, while sarcomatoid might favor immunotherapy. Your stage and your treatment goals will be discussed, and so will your age and overall health. Kidney function, hearing, and nerve health influence platinum drug selection. Prior treatments matter for second-line choices. And finally, a lot will depend on your thoughts and preferences about tolerating side effects versus maximizing effectiveness. What questions should you ask about your chemotherapy? Start with, why are you recommending this specific combination? Are there alternatives? What are the expected benefits and the likely side effects? How will you monitor my response? And what happens if this doesn't work? Finally, am I eligible for clinical trials or newer combinations? Understanding that chemotherapy isn't one size fits all helps you participate actively in treatment decision and know what to expect from your specific regimen. So, to review, mesothelioma chemotherapy varies significantly. First-line options include pemetrexed plus cisplatin or carboplatin, pemetrexed plus platinum plus pembrolizumab, or dual immunotherapy without chemotherapy. Second-line options include gemcitabine, vinorelbine, or clinical trials. HIPEC for peritoneal disease uses cisplatin or mitomycin C heated and delivered directly into the abdomen. Regimens will differ in effectiveness, side effects, and appropriateness for different patients. Your oncologist will choose based on all of these factors, including cell type, stage of disease, your health, and your overall treatment goals. You can visit mesothelioma.net for more information about chemotherapy options and treatment, or to speak to somebody right away, you can call us at 1-800-692-8608 and speak to one of our patient advocates. You can also use the live chat feature on our website. As for me, remember to post your questions below, and I'll see you next time.